there are simply not enough intensive care units and enough hospital beds if there's a wave of severe cases of COVID. And what many people are wondering is why the Chinese government didn't, in fact, spend the last 2 or 3 years preparing for this, but they didn't. So
Well, China is seeing a surge in COVID cases since the lifting of its most severe restrictions earlier on this month. Schools in Shanghai have been ordered to hold classes online. A top Chinese health official says he believes this is just the first of three expected waves of COVID infections this winter. Let's hear more about that now from Jeremy Goldkorn, who is the editor in chief of the China Project. Jeremy, thanks for being with us.
thank you, Hannah.
It sounds worrying. Is it?
Well, I think if you can put yourself back to early 2020 in London,
I don't want
that's
to.
well, yeah, nobody does. But I mean, that's what China is going through now. They are going to deal with the pandemic in some ways, just like the UK, Italy, the United States did at that time.
Right. So is it? But I said schools in Shanghai have been ordered to hold classes online. Are we now seeing other institutions affected, or are we just at
Um,
schools at the moment?
No, it's schools. Companies are asking people to work at home, and um, the government has basically given up on its COVID zero policy. So the government is no longer necessarily forcing people to stay at home, but people seem to have chosen to stay at home. So um, our correspondents in Beijing and Shanghai and Chengdu and some other places in other cities in China have reported this weekend that it's been extremely quiet in downtown commercial areas where people usually go shopping and stuff on the weekends. People are just choosing to stay at home.
And do you think China's health infrastructure is prepared to cope with this sort of rapid increase in patients?
Probably not. Most people who uh, know a lot about the Chinese healthcare system say that there are simply not enough intensive care units and enough hospital beds if there's a wave of severe cases of COVID. And what many people are wondering is why the Chinese government didn't, in fact, spend the last 2 or 3 years preparing for this, but they didn't. So China doesn't really have more hospital beds than it did at the beginning of the pandemic. And this has been a problem, for decades in China, that there are not enough hospital beds. And it's particularly acute in China because there's not really sort of family doctor or regular physician type of system. People don't go and see a doctor if they get sick. Even if people get a cold or a flu, they're quite accustomed to going to hospitals. So it means that the hospital systems somehow get even more overburdened, when there are diseases going around, because everybody goes to the hospital, not to a smaller clinic or a family doctor.
Do you think this will mean China will reverse or start to think of reversing its decision to ease restrictions? Uh,
It's very difficult to tell.
yeah.
It's very, very difficult to tell. And the Chinese government is a black box. Then it's very opaque. They don't make their decision-making process open at all. And there's some pride at stake. For more than 2 years, they were promoting the fact in their propaganda, both externally to the outside world, but also to their own citizenry, to their own citizens, that they had performed really well in the pandemic. And whereas in the US and the UK, millions of people were dying, and in the West, that wasn't the case in China. The fatality rate was really low. So for them to change the messaging has been quite difficult. And we still are not clear on what they're going to say about it. I think we can be pretty sure that the numbers of people who die are going to be fudged.
So they're going to be not going to be putting clear messaging out there. You mean about on that side of things?
Yeah, we won't know how many people have
No,
died. I don't think
interesting.
we'll
Yeah,
ever know.
no.
They're not going to report the true death numbers. And yeah.
Well, it's fascinating hearing from you, Jeremy Goldkorn there, who is the editor-in-chief of the China Project, talking about the surge in COVID cases in China since the lifting of its most severe restrictions, which it did earlier this month.